Hello, my dear friends. Welcome to Aspire32. And today's podcast is something different. We generally cover the opportunities for the undergraduate, postgraduates, but I came across a very important topic in my practice, and all of us love doing composites. We have covered composites on our Aspire32 channel very well theoretically, but when it comes to practice, especially when you're a beginner, there are so many materials which are available in market. There are so many advances which are often asked to you by your teachers also. And even you can use those composites in your practice. So today's podcast is about that. And it's a pleasure that today I have Dr. Kartik Raman with me. And sir is practicing in Aurangabad from 17 years. He is a faculty in CS MSS Dental College, Aurangabad. He is a postgraduate in MDS Conservative Dentistry and Endodontics, a postgraduate mastership in modern aesthetic dentistry from British Academy. And sir has been speaking on various topics, but today's topic is about single shade composites. And before talking on this topic, sir, welcome to Aspire 32. I'm glad to have you on this channel and hope to listen to your experience about this new dental composite in the market.
Thank you very much, Dr. Suresh. It's such a pleasure. Since I'm a teacher, so my only intention is that it adds value to every person who's listening to this podcast, either through whatever knowledge I have or through whatever cases that I have done. And I'm sure this half an hour is going to be enlightening for them.
As you said, that it is always a learning experience in dentistry. And when I came across this topic of single shade composite, I had so many questions, and I'm grateful that today I have an opportunity to talk on it. So first, I want to listen to your experience of this material. Although we are discussing about the material later, but I just want to know that how you came across this new composite, which is marketed as a single shade composite. Why did you think of using it?
So first and foremost, you must have. I think are you married, Dr. Suresh? I've never asked you this.
Yeah, I am married, sir, with a kid of 5 years age.
So I'm married for last 15 years and I have two girls. So I have three ladies, and so when we go out shopping, I always used to find myself, in a weird situation. She used to ask me, how do you like this color? And I used to tell her, Dr. Suresh, that, oh, this lavender is amazing. She used to say, this is not lavender, this is purple. And I said, no, no, it's not. What is, no, no, this seems purple. No, no, she said, no, this is lavender. Then I'll say, okay, I like this shade, this pink is good. She will say, no, this is not called pink, this is called Rani color. And I am at weird ends. I don't know what is going on. And this same issue used to crop up when I used to do a shade selection for composites. So when I, as a teacher, I kept on researching why this keeps on happening. So I came across an article by various companies, especially Kulzer and this company called Tokuyama. I'm very sure everybody has heard of this. They are legends in their fields, and both articles uh, showed some startling revelations to me, and that is 1 out of every 12 males is colorblind. And the surprising part is that most of the shade selections, that is, if you see the Munsell curve also, the Munsell sphere of shade selection, hue, value, chroma. So uh, those 14 shades of dentistry, A1 to D4, all fall under the category of red, yellow, and maximum people who are colorblind to some or the other degree. This is actually a study. Dr. Suresh, you can also go into this study. It's by the National Institute of Eye, conducted in the UK. And that's where I came to know, okay, oh, it's not because I'm bad at shade selection. It's because there may be some defects in my rods and cones that has always given me this challenge, or that puts up this challenge in front of my eyes to keep doing shade selection. My wife is my teacher in composites, and you'll be surprised, Dr. Suresh, she's been practicing composites since 14 years, since the time I am teaching. So she's always been extraordinary with composites. She matches shades beautifully, she blends them beautifully. It took me a lot of time. So I have been very interested in composites for the past 5-6 years, but single shade composites drew my attention because of this one single issue, that is shade selection. And of course, when I used the material myself, I was very impressed by both the Diamond One by Kulzer and as well as Omnichroma. And I've been using Diamond One for the past 8 months now and done my share of lot of mistakes. And slowly I can see myself evolving, case by case, step by step. But Suresh sir, it's not a panacea for everything. So it's like single visit root canal therapy. So as you know, single visit root canal therapy cannot be applied everywhere. It has a strict standard operating protocol, case selection. Same way, if you can select the proper case, if you follow the proper protocols, then it's a beautiful material to be used. Single shades are the materials of the future. And one more thing that I want to put to your notice: whenever you have lectures on aesthetic dentistry, Dr. Suresh, you must have come to notice this, that there are maximum ladies sitting in this lecture rather than males. And this is the reason why we feel, अरे यार इतना problem है shade selection के लिए, such a issue for us. Why to do such a big shade selection? You have an anterior composite or a posterior composite, don't do that. Do a root canal, put a crown. And for the anteriors, now we have the privilege of using veneers, zirconias, emax, easier for people and especially males के यार वो बोलते हैं इतना किट किट कौन करेगा, better to invest so much armamentarium to invest in composites. Second reason that I got interested in single shade is the armamentarium has gone down. So I used to have, I still have, of course there are Filtech Z350 3M composites are just unbelievably good, no doubt, because 10 years we've been using that only. But 30 shades, Dr. Suresh, and now just few shades. So it puts less stress on my day-to-day expenses in the clinic, as well as gives me a lot of relief while shade selection also.
So true, sir. But I do. I'm sure there are practitioners who will understand this. But for the viewers who are beginning, who are just undergraduate students, who are new in composite, I really don't know whether they understand what single shade mean. So can you just tell them in a very simple way what exactly this single shade mean and how different they are with the other composites?
So sorry, I'll just reiterate that in a minute. So everybody knows the chameleon, that when the chameleon comes in contact with the branch or jumps from one tree to the other and changes its color from this particular tree leaf to that particular tree leaf. How does this happen? This chameleon effect is the same that is used by the composite. The composite alters its color. Now, how does that happen? Now, everybody knows when you see a compact disc, everybody has seen a compact disc. And when the light reflects or refracts from a compact disc, it doesn't just reflect the silver color of the compact disc. It reflects all the shades. Now, how does that happen? It happens by refraction and reflection. And single shade composites by themselves are not, no color is added to single shade composites. They have some technology called adaptive light matching. Now, how does that adaptive light matching works? So as everybody knows, composites have a combination of fillers, matrix, and then other things. So fillers have their own refractive index, and the composite, the matrix per se, also has their refractive index.
So what you're saying is, instead of 30 shades, like for example, our students may know that there are A1, A2, A3. I think in general, people might be aware that in an intro kit, which everybody uses, is from A1, A2, A3, maybe there is one B2 component. So what the students should know here, that actually there are even body shades, there are dentin shades, and there is enamel, translucent. And what sir is saying here, that there is only one single composite which, if used in a proper case, you can avoid using all the other shades. Is that right, sir?
Absolutely, you nailed it. That's how it is. So no need to use body shade or dentine shade or enamel shade. There's just one composite which will fulfill the all the intention and outcomes of using a composite. But just because they are students, so I just thought I should introduce this technology called adaptive light matching.
Yes, sir. What exactly is this adaptive light matching, sir? What does
that's
that
what I
mean?
was. So adaptive light technology or light matching is what is basically how this is named in science. Whereas for a layman, it's called the chameleon effect. That is, once the composite is blended to the adapted to the tooth, it matches the tooth color. Now, how does that happen? Because of the way the refractive indexes or indices of the filler and the matrix are manufactured. So they emit the yellow wavelength. That's how, and they adapt to the adjacent tooth structure. So this is called adaptive light matching. And the fillers per se, so they are manufactured by a colloidal process, and through which you have aggregates of these nanofillers. So it's basically a nanofilled composite. So a little higher up, or as far as the advance is concerned, so they are nano clusters, Dr. Suresh, wherein because of the agglomeration, they are spherical in size, and they emit the red yellow wavelength. So rather than any addition of color to the composite translucency refractive indices are matched such a way that they emit the shade, what they absorb or what they get from the adjacent tooth. That's how adaptive light matching works. That's why it's such a great thing. Of course, um, as I said, it's not a panacea for everything. There has to be a protocol, and I will talk about it as we go ahead.
Exactly, sir. So this was my next question, because I did try the single shade composite. It was new to me. That is why I thought, why not ask from the expert? You are a key opinion leader for the Kulzer, and you have been speaking on single shade composites from so much time you have been using it. So you explained us that what is this adaptive light technology, and I'm sure sir has explained it in a beautiful, simple way with an example which all of us can understand. But of course, for someone who has used other composites, other shades for so many years, for them to believe that one tube of a composite can replace everything, that may be really unbelievable. And
Yes.
that is what,
Yes.
maybe that is why today's lecture is so important, that your experience can make them believe and they can even try this product.
Yes.
So, what is your experience? Can you do class one, class two? See, I can understand class one is a small restoration, class two is a bigger. You have anterior restorations. Can you use these single shade composites which have chameleon effect? Can you use it in every situation, sir?
Yes, you can use it in every situation, but it requires a lot of practice. Like I reiterated before, that I've been practicing with the single shade composites for 8 months, and first 3-4 months, just the use in class ones and class twos was very simple actually. But the challenge came when I had to do a class 4 or a diastema closure. So it was very, very challenging. And we got in communication with our key opinion leader, Janine Schwepp in Germany. And then we asked her how to go about it. And then we came to know, and we devised various methods to use it. So Tokuyama also advocates the use of blockers, so that you have either an opaque shade or a shade with higher uh, filler content, which can be used as a backing, so that light doesn't reflect completely from the other aspect. So you need a blocker or a opaquer when you are working in the anterior, especially diastema closures and class 4. But for class 5s, or for that matter, even class 1, class 2, it matches beautifully. I have a lot of cases to share. So if given permission, I can share a few cases where you could see the difference. And they have also demonstrated to have extraordinary compressive strength also. So I have few comparative studies where we have compared that with Omnichroma. Omnichroma is also a beautiful composite that Tokuyama has evolved. And as you keep mastering the art of using single shade composites, it can be used in each and every case. Yes, but as I mentioned, class 4 and class 5, it's a deeper class 5 cavity, then we better use blockers or opaquers before we use single shade restoration composites.
So this opaquer, sometimes you get it in a separate tube. So which one do you recommend? And what is your clinical protocol? So you said, okay, in deeper cavities or anteriors, you have to use this opaquer. And how do you actually, in a simple way, if you want to mention the steps in this composite restoration, what would be those important steps?
So
So, like
first and foremost is,
for example, we do give bevel. We have all those primary requirements. Do you still have to
yes.
follow it, or no? Maybe there are some modifications.
Dr. Suresh, the protocol is the same. There is no doubt about it. Proper case selection, as I told you. Second thing is the the isolation protocol, and then comes your beveling. So without the KLE preparation, Dr. Suresh, it's not possible to do any composite. So just because we have single shade, so we can eliminate the use of, in simpler terms, if you want to use the word bevel, you can use, but I would call it a KLE preparation, a preparation which, which has its margins extended so that, the composite can envelope or hug the tooth. I always tell my students, the composite hugs the tooth. So in that way, see, Dr. Suresh, the sides of the enamel rods, if they are engaged, the bond strength is always weak. So we tend to use a KLE preparation where we engage the 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 periphery or the ends of the of the enamel rod, so that the bond strength is very good. So protocols are same. So we prepare a KLE preparation. Then we have, so depending on whether the depth of the cavity needs to be taken care of. So that's why case selection is so important. So take a proper IOPA, do a proper vitality test. So there are many different, so if given an opportunity, I would definitely like to talk about bonding protocols, maybe at some other day. But if we are very clear about the affected and infected dentine part, which is, if it is very clear in our heads, we can bond to even affected dentine. So if proper depth is taken care of, proper use of desensitizer is done in deeper cavities, and then we can directly use these composites. If they are very deep, yes, you need to use a blocker. Blocker is available from Tokuyama also. Blockers are our routine opaque shades, depending on the whatever. You can use any kind of opaquer, but basic shade of the tooth, if you are able to decipher, then depending on that, you can use the opaquer. I use a Kulzer blocker or Tokuyama blocker, whichever is available with me at that point of time. The protocol is not different from any of the other composites that we have been always using, or the protocols that we have been always using. Just that I make sure that sensitivity should not be an issue in my composite. So I make sure that I use a desensitizer. That's what I want.
And which brand of desensitizer do you use?
I've been using a Gluma for many years now. Even my partner, Dr. Zoshi, who's a prosthodontist, even after a crown prep, we have a protocol set. Even after a routine crown cutting, we use the Gluma desensitizer, keep it for 30 to 60 seconds, wash it, air dry it, or nowadays we don't air dry it. We use a chip syringe, or we dab the tooth with a sponge or a gauze piece of gauze, and then we go ahead with temporary luting with a temporary crown. Or if you have deeper composites, then same protocol, then we go ahead with the etching protocol. The only important thing is, when you see enamel, etch it. So I am a complete follower of the selective etch technology. So I really believe in that. So whenever you see enamel, doctor, etch it. That's the only way any restoration is going to be, serve its purpose in the oral cavity.
Which generation bonding agent? Because now in the market we have 8th generation bonding agent. There are 7th, there is 5th. Selective edge technique, of course, you can always use it. But along with that, do you prefer to use a 8th generation bonding agent, sir?
Yes, you can always use a 8th generation bonding agent, but even a 7th generation is fine. Even a 5th generation is also fine, but 5th generation will require a total edge, as everybody knows. 7th and 8th generation can be used in selective edge, but I always tell all my students, and I request all clinicians, colleagues, seniors also interacting with me, you see enamel, you etch it. Don't even think about selective edge. Of course, in deeper cavities, we know for sure that if you're using selective edge technique, you are not etching dentine, then the cases of sensitivity and the longevity of the restorations are taken care of, definitely. So don't etch dentine as much as possible. They say 5 seconds. I prefer to use selective edge. That's why.
So you mentioned that in a deep cavity you would put a opaquer, a barrier, and how can you give a depth? What is it? What has been your experience? Is it 5 millimeter, 6 millimeter? Because that would help the viewers here. What is the depth at which you would like to place them, opaquer or
opaquers or blockers?
Yes,
it's a very good question. So first of all, you have to get that more than 2 mm. Let it be any composite. It cannot be cured, or it should not be cured. First thing, I strictly follow that since many years. Since I do what I teach, and I teach what I do. So any cavity depth more than 2 to 2.5 millimeters, it's better that you use some flow or some opaquer or blocker. When it comes to class 2 restorations, Dr. Suresh, we need to be very clear whether the tooth what status of vitality does the tooth have? First and foremost, have we done a proper vitality testing? Have we done a pre-op IOPA X-ray? If we are very clear about that, then if on excavation of the infected dentine, are we getting any exposure? Are we putting a good isolation? If we have to use biodentine, use that. Over on top of that, you can use I use a light cured glass ionomer cement, because it gives a good cushioning effect also, and it helps my biodentine to stay in place also. You can use MTA also as a pulp revitalizing agent. That's also fine, not a issue. But after that, the protocol comes that you have to build to a certain level with opacers.
And what might be the thickness of the opaker? Is it
At
1
least
millimeter?
3 mm, at least 3 to 4 mm. I
3
always
to
feel
4
if
mm.
it depends on,
Okay.
it depends on how deep. I have a habit of, you know, requesting patients that I want to do a pulp capping. Can I? So I always have a written consent, Dr. Suresh, about pulp capping. I'm very crazy about pulp capping. Patients come to me, referred from other friends and all, for root canal therapy, and they end up going back with a class 2 composite restoration.
So
But let me tell
that's
you, Dr.
because you
Suresh,
are a conservative dentist, and a conservative dentist and endodontist. Whenever I believe that we are always first conservative dentist. That generally doesn't happen with other practitioners.
but I always have noticed that in my 17, 18 years of practice, Dr. Suresh, uh, my pulp capping, I can, you can also see it in the reviews that I have on Google about my hospital, that pulp capping is something which I educate the patient about, and I request their consent that give me an opportunity to save the tooth. Even if you get it exposed, no problem. We can still, if it is falling inside the standard operating protocol, definitely go ahead with. And it's been a great practice changer for me. So from my endodontist, now I have come back to being a conservative dentist, and that's a great transition. I tell you, for everybody. And if we can do that, and Dr. Suresh, if I ever get an opportunity, I would like to always re-emphasize that the greatest stalwarts of endodontics are now coming to the point of doing pulpotomies. You'll be shocked to hear Dr. Uh, Rico, or many stalwarts from Cybron Endo talking about revitalization. Don't touch the root canals. So we are coming towards more and more conversations about, only, removing the infected, which we have only taught. Now we are actually implementing. This is a new era in dentistry. I think this has never been so. In my practice of 18 years, it's a revolution now. Conserve.
And
And
I
now
think
the
there is so much of
protocols.
advance even in the composites, the
Yeah.
techniques, the magnification. So you did mention that 3 millimeter is the
Yeah.
opaker, and then
Yes.
you place the
2-3
composite.
millimeters, depending on the case, Dr. Suresh. One
Okay.
more thing about single shade composite, especially the diamond one, which I'm using, is the TCD urethane matrix. So generally, we have been using all these Bisgamma
Precision.
products, right? And
Yes.
MDP monomers. ऐसा कुछ तो हम use कर रहे हैं काफी time से. So what makes a difference is that, this TCD urethane matrix now has a unique quality, that the vibrations of the atoms and molecules is very less. So the more the vibration, the less stable the material, the more chances of it having a breakage of the bond with the tooth structure. TCD urethane matrix gives lot of stability to the to the shade also, stability in the shade, stability to the material overall. So less shrinkage, less polymerization issues, and third most important is, due to that, less chances of post-operative sensitivity. That's what makes this material very unique. I have no exact idea about Omnichroma Tokuyama, but I can vouch for that. I am seeing a lot of difference in the matrix per se, and it's a new product, and it requires some amount of practice for each and everyone. And once practice, I think it's not a big deal.
What do you think? Once the people start using the single shade composite, what has been? I'm sure you must have recommended to so many people, and when people use it, for example, when I got this composite, when I started using it, it appeared like it is matching, but it is not exactly. It's slightly grayish, and that made me realize maybe I'm not doing it properly, because we have so much of information on YouTube, the brochure, where it is matching, the results are good. And then I thought, why not make this podcast, so that at least all of us may get some information from you, so that they can avoid the mistake. What has been your experience? What is the first complaint people come to you when they start using this single shade composite?
So out of all the people have recommended single shade composite, class 5 they had a complaint, or a translucent take करके. So that's the time I told them, if you remember, I told you कि you have to gauge the depth of the cavity more than 2 mm. You put a blocker. Then they said, हाँ, वो मैं directly use किया to save time. So we inherently have this habit of saving time. Most of the friends I had recommended to are mass practitioners, so they try to do it fast. So I always tell them, you follow the protocol. Second, they didn't experience too many issues with shallow class 1 composites. So it's a beauty, absolutely, in shallow class 1 composites, or even class 2s also, where shade matching is not a very big deal. But if you want to match the shade the way it is said in the brochure, you have to follow the protocol, as I told you. See, you have a depth more than a certain. So if you see more of dentine involvement, please make sure that some amount of additive opaquer is a must. It has a
So,
beautiful polishability also. That's
yeah.
what. So an added advantage of the TCT matrix, very amenable to polishing. So the luster also is very good.
This resin matrix, is it available? Is it all that every composite which is made from the Kulzer, do they have the same matrix or is it
No,
only in the single shade technique?
no, it's
Single
only
shade.
in this single shade, and
Okay.
we don't have Venus. Sorry, yeah. So they started with Topaz 1, a single shade composite. Then slowly the matrix was evolved into a TCD matrix in Diamond 1, and now the research is still going on. So we are awaiting when we will get to know more about the evolved single shade composite. So it's launched in the US. Now they are still in the process of research and development, so to better the results. And once a proper cohort study is available to us, then we can see it in India also, about how successful the evolved version will be. So Dr. Janine Schwepp is involved with this R&D continuously. So she's spending a lot of time in evolving the shade matching, more and more shade matching ability. So translucency is always a challenge in dentistry as far as single shade composite is concerned. But it's doing well. I'm pretty happy with it. Saving a lot of my time, and my patience is also stable.
Yeah, yeah. But I still have one last case difficulty that I want you to answer. As you have a class incisor ledge class 4, a fracture where your incisor ledge is broken, and in that, how do you, maybe it is 4 millimeter thickness or 5 because we know that the tooth would be very small. Do you prefer it there, or do you advise practitioners that maybe that is not the area where you should use the single shade? Because although we can always make a mold, a matrix, a putty matrix, use it.
Absolutely.
Generally in layering technique we use translucent then body. What is your suggestion for, or your experience in treating such cases with single shade?
It's very difficult with single shade composites for every case. No, not possible. Not possible at all. Please don't
Without
break
with
your
even
protocols.
without the opaquer, it is not
Yeah,
possible.
yeah. It is a very challenging prospect in a difficult case, especially where your incisal edges. You know what I'm saying. If the incisal edges are translucent, if they have these white spots that you need to mimic, so it becomes a challenging case. So definitely, I don't use it in all my class 4s or diastema closures. I first evaluate. We have a habit now as a team to do a lot of photography. So we evaluate the case. My wife and I sit together, see whether really we would be able to serve the patient. It's not about the product. My focus is whether the product can serve the patient. The patient doesn't need to serve the product. So if it's a very challenging case, we don't use a single shade composite. We will stick to our typical histologic technique of doing involving all the 3 shades: body, opaquer, and match of enamel, and whatever uh, tints we need to use to give it the kind of look that we want to give to the patient. So posteriors not a tension at all. Posteriors, class 5s, even restorations involving lateral incisor and canine closures, very easy. But when it comes to anteriors, yes, needs lot of practice and lot of evaluation from our side as a practitioner. So not all cases, Dr. Suresh, not at all.
Sir, and what about the timing? Do you see? I'm sure not everybody does multi-layering. Generally, people use either A1, A2 in these 4 shades. Majority of the practitioners.
Yes,
Do you
yes.
think by shifting to single shade, Is the time reduced, or maybe with the same time your results or shade matches improve? In this aspect, what has been your experience?
Yeah, time to definitely has reduced, because now I don't have to keep on putting blobs of composite, curing them, then removing them, then curing again. As a male, I face these difficulties. Maybe many of the females who are using composite for a long period of time, they don't have this issue at all. That's what I'm saying. For this particular restorative material is a very has a very amazing distinction of being very holistic. We are trying to influence all people to go into composites and use composites. That's the basic funda behind single shade composites. So I'll tell you, as not only as an endodontist, as a conservative dentist, as a dentist per se, as a male dentist per se, I was a little bit reluctant to do composite because of the shade matching ability. Sit and finally remove everything and again redo everything was always a fear that is going on at the back of my mind, Dr. Suresh. So it has reduced my time. Most of all, it has reduced my fear about shade selection. That was always an issue for me.
There is one question which I also always thought, that you have a different matrix system, and maybe you have a different matrix system of flowable. Will these two composite bond even with having two different matrix?
Yeah. This TCD matrix has not completely replaced the core of the material. Yes, we have, because only one matrix. That's why it's called composite, no, Dr. Suresh. It cannot have only one matrix. It has a combination definitely, but maximum composition of the diamond one is by a TCD urethane matrix, and that's why the kind of stability we are getting, the kind of my most biggest challenge now, Dr. Suresh, was post-operative sensitivity in class 2 cases, and it has gone down since I love pulp capping. That's what I'm coming to. So it's not completely replace the matrix, but yes, majority of the matrix is TCD urethane.
Now, since we are at the end of podcast, and I want you to conclude, the first thing is, I'm sure you must be using the Kulzer brand of a composite, and you also mentioned which other brands are also available. And I believe these are available in India. Both. Do you have both the composites in India, sir?
I have, yeah. I have almost 9 companies that I'm using.
Okay.
More so, my practice evolves around or revolves around Kulzer, but
Okay.
I have been using, because since I'm a key opinion leader, I have to keep comparing materials. I have to keep on evolving. See, being a teacher, there's always a background of authenticity where I have no cons about telling you, no, Dr. Suresh, you cannot use them everywhere. As I told you at the beginning of the podcast only, it cannot be a panacea for everything. You have to evolve as a practitioner. Through practice, you can use it almost everywhere. So I have been using, and what I said about Tokuyama, yes, Omnichroma is available in India. So Kulzer is available in India. 3M is available in India. So all the brands today are available in India. I find Kulzer, Dentsply, um, Tokuyama to be the finest composites, and of course 3M. Sorry, I cannot talk about. I
So, what
cannot
is your concluding
conclude about.
remark? Yeah, what is your concluding remark, or what is your message for the people who want to try single shade composite?
Yes, just go ahead, try, and it's a practice curve. It's a learning curve, but by practicing, you can overcome this learning curve of shade matching, and as well as this relief in shade matching is going to give you support to do composites faster, as well as more reliably as far as shade selection also is concerned. And most importantly, post-operative sensitivity can be a great leap ahead, where we can overcome that in our posterior class 2 restorations.
Thank you, sir, and it was wonderful talking to you. And I think we should also thankful to Kulzer for getting you on Aspire 32, and so that we can listen to your amazing experience about the single shade composites. You have spoken all the positive and the negative aspects one should consider before using this composite. And as you said, that it is always better to keep trying. The podcast was really inspiring, sir. I thank you
Thank you
once
so much.
again for your presence and your knowledge, which you have shared with us on Aspire.
Thank you so much. Thank you for this opportunity, Dr. Suresh. It's been a pleasure. And all the best to everyone, wherever you are listening to this podcast. And the only way to overcome fear is practice. Thank you so much.